I'm not sure why people don't talk about when you do end up losing so much weight, what happens to your body afterwards.
You've lost the weight, but you're not done.
There is this secret out there that people don't talk about.
It's a dirty little secret.
When I was at 625, I was almost bed rest.
Yeah.
Because my knees was getting weak. And
So you couldn't get out of bed.
No.
So now you're walking, you're moving around, you're exercising. Good.
You know, I'm still young age. I'm 43, and you know, don't want to die soon. And I was headed that way. And I've also got 2 young kids. They done lost one father. They're my stepchildren. And I don't want them to go through that again. After the weight loss, I was getting ready for church. And I was putting the pants on. And I told my honey, I told her to look. And I just dropped them, and they fell.
I went through my weight loss struggles, especially after having my daughter. I had gained about 80 pounds during my pregnancy. And after gaining all that weight and being so uncomfortable and just going through all those different changes and emotions of being a new parent, I really realized that I needed to get healthy. These are my old pants. Now, after losing all the weight, I'm able to go for walks with my daughter. I feel amazing. I just feel full of energy, and just to be healthier and knowing that I have a little girl to look after and I have a family to, you know, spend a long life with, it feels great. I feel like, you know, I get the gold star for losing the weight, but I'm still sitting here like waiting for this body that I've always wanted.
These patients are told by doctors and surgeons time and time again, just have the gastric bypass surgery, just have a lap band, you're going to be fine.
It's not true.
Even though you had weight loss surgery, it's still not over because you still have the loose skin to deal with.
Problem is they have these rolls and rolls of skin that sort of no one ever told them that they were going to have after this massive weight loss.
You know, before I started losing the weight, you know, the belly was there, but since I lost, now it's hanging more than what it is. It's, you know, it's hanging pretty low, and it's not, you know, good for the back.
Breast down sometimes below belt line, tummy's down below knees.
I ended up with these shrinkly arms that would literally melt down.
Could you admit to somebody else that you have to lift up your stomach to wash underneath it? You sit there and say, God, that's gross.
No matter what I did, it would never go away.
I don't give a shit how much exercise you do. It's not going anywhere.
You somehow feel responsible for what you're left with.
I was fat. I couldn't take off my shirt. I'm skinnier. Never gonna take off my shirt again.
It's just really hard to feel secure when you have like that extra skin, and it's kind of like I feel like a 23-year-old in an 80-year-old's body.
It's like I'm deformed.
I have patients that have lost sometimes 800 pounds, and they come into my office and they go, Dr. Katzen, literally, I don't know where to start.
The only way to get rid of it is to have it removed.
Oh yeah, this is my extra wave when I wave to people. I hate it. I want it gone. I can't wait to have surgery and get rid of this.
These are not just your average Beverly Hills nip tucks. These are, you know, big surgeries. Probably give me about 4 or 5 hours under anesthesia, completely asleep for the whole thing, of course, and then probably at least a couple of days in the hospital. My nips and tucks are extreme. They're 20, 30, 40 pounds of skin and fat that I'm taking off. From what I've heard about the recovery process is that it's very painful.
The pain is intense. It's not, it's one of the hardest things I ever did.
You have swelling, and you're bleeding, and you have stitches everywhere, and you can't move. It was expensive. It was painful. It's a long recovery time. 3 months can be an eternity.
Your typical plastic surgery patient, you know, very sheltered, doesn't really want to tell anybody about the procedures they've had, very, you know, quiet, doesn't really want anybody else to know. Versus my patients, they're jumping up and down, jumping all over the internet. Look what I've had done. Look at my scar here. Look at my scar there.
Bariatric surgery gave me my health back. Well, plastic surgery gave me my life back.
It is painful emotionally and it is painful physically. However, I would argue that the rewards are far greater.
So to be able to, have surgery and change my body and to be more confident would just be amazing. It's so hopeful, and I feel it.